Hey guys, good morning and welcome to my channel. My name is Violet Okolocha. I talk about everything about OSCE and nursing here in the UK. How have we all been? I'm super excited because I got over 30 messages, 30 emails. I passed on first attempt. Thank you so much. Thank you so much. Oh, bless you all. I'm super proud of you all. Thank you so much. In fact, guys, thank you all for your support. So a lot of people sharing my videos, subscribing, liking. Guys, I really do appreciate and thank you so much. So guys, please keep supporting me, keep sharing my videos with your friends preparing for OSCE exam, keep liking, and you know I always love to read comments, so please comment on my videos. So guys, today I didn't plan for this video today. I was just pushed. Somebody had an issue and she said, please can you do NGTUBE, and I promised today I was going to do it. So I didn't really plan for this, so I didn't order all the equipment I need, but I can assure you, you are going to get the knowledge you need for this video. All right, guys. So let's get started. We are going to be dealing on NGTUBE. This is a new skill in your nursing OSCE exam, and the time allocated to this skill is 8 minutes. Now, before I perform the skill, show you how to do the skill, I like to tell you points you must note. There are items you need for the skill, and one of them is Entera pH strip. All you need to do is to put the gastric content in this and you get your pH, and for sure the pH has to be less than 5.5. so it is not difficult at all. It is one of the easiest skill, and bet me when I tell you, you will finish before 5 or 6 minutes. That's how easy the skill is. I'm going to be sharing the techniques with you in this video. All right, so outside Entera pH strip, you'll be needing a gastric content. Because it's a manicky, definitely you can't aspirate any gastric content, so they'll be giving you a gastric content. This will be labeled either in a gallipot or in a syringe. You see it labeled gastric content, and you'll be needing a warm water. A warm water is to help you lubricate your NGTUBE, and you have to lubricate 15 to 20 centimeter of the NGTUBE for easy passage. Another thing you'll be needing is a purple syringe. You need a purple syringe to aspirate. And another thing you'll be needing is gauze. And finally, a plaster to secure the NGTUBE in place and your NGTUBE. So that's all you need for this skill. And before I proceed, endeavor to tell the patient, if you feel you want me to stop when I'm passing the NGTUBE, please, my love, do you mind raising your hand? And that will tell me that you want me to stop. Is that all right? And please, my love, as I'm passing the NGTUBE, do you mind swallowing for me? Because it makes it easier. All right? So while I'm passing the NGTUBE, do you mind swallowing for me? And the patient will tell you yes. And finally, endeavor to check that the nostrils are patent. How do you check that the nostrils are patent? You have to make sure you ask the patient to sniff with one of the nose closed. So sniff with one of your nose closed. Perfect. Can you do that to the other side? Perfect. Now I can see that it is what? Your nostrils are what? Are patent. And you have to remember to check that the tube is in placement before you start feed. So verbalize that you will make sure you check the tube is in the right placement before you start feed. How can you do that? You can do that by putting the gastric content on the NGTUBE and double check there's the NGTUBE, but the Entera strip as like a container. So if you put the gastric content on this, you turn it over and you check. Usually you have to get less than 5.5 for you to be sure it's in placement. Or you can also verbalize, you can send the patient for an X-ray to confirm the tube is in placement before you start feed. So guys, that's all you need to know about the skill. Really simple. Now, what if your assessor tells you, assume you've checked for scene safety, assume you've provided privacy, go ahead with your patient. Somebody said to me, I was thrown off balance and that is why I had issues. Guys, I plead with you, OSCE is very simple exam. Don't be thrown off balance. If your assessor tells you, assume you've checked for scene safety, assume you've provided privacy for your patient, just go ahead to your patient and introduce yourself. Don't be thrown off balance. If she tells you, assume you've checked for scene safety, assume you've provided privacy, go ahead to your patient. Just go, hello, my love, my name is Violet and I'm one of the nurses looking after you. Can I know your full name and date of birth? So don't let that throw you off what? Balance. So guys, that's all I want you to know about NG feeding. Really simple, guys. Really simple. Sometimes every item you need is already assembled for you in a tray on a trolley. At other occasions, everything is not really well assembled for you, but they are all close by, so you need to pick them up. Is that all right, guys? Really, really simple. Okay, so let's get started. I will do it, but I really didn't have all the items I need. All the items I needed for this skill have not come. I actually ordered them. They've not come, but because I have someone who is taking a receipt on Monday and she's been on my neck, please, can I just watch your video? So I'm doing this video for her, and hopefully I know she's succeeded already. So let's get started, guys. I approach my scene. I see my scene is safe to approach. I provide privacy for my patients, and I do my hand hygiene according to WHO method. So I put gel on my hand, palm to palm, right palm over left dorsum, vice versa, fingers interlace, fingers interlocked, fingers interlocked, rotation of the form, tips to the finger, and the wrist. So my hands are clean. I can now approach my patients. Now, before I approach this patient, I like to tell you, you have a question, right? There is a question for you to read. Like I said, NGTUBE is one of the new skills. So they will give you a scenario. The scenario is usually very, very simple. This is one of my formulated scenario. Ellie was diagnosed of cancer 4 years ago. She has not been feeding and has difficulty swallowing and has lost over 40% of her normal body weight. She was seen by a doctor this morning, and the doctor recommended NGTUBE passed. So assess Ellie and pass the NGTUBE. So what happens? Once you go into the exam, the assessor tells you, sorry, Violet, this is your skill. You are going to be having NGTUBE as your skill. You could read your question and proceed to your patients. If you have any question, just let me know if you have any issues. Of course, you won't have any issues. An exam, your question is there. Read your skill and go ahead. And the assessor has said to you, you are having NGTUBE. So just read your question, then go ahead to the patients. So, guys, now I've read my question. Ellie was diagnosed of ovarian cancer 8 years ago. She has not been feeding fine and she has been having difficulty in swallowing. She's lost over 80% of her body weight. The doctor has recommended NG passing. So based on this, assess Haley and pass the NGTUBE. So I've read my question now. I approach my scene. I see my scene is safe to approach. I provide privacy for my patients. I do my hand hygiene according to WHO method, palm to palm, right palm over left dorsum, vice versa, fingers interlace, fingers interlock, rotation of the form, tips to the finger, and the wrist. So my hands are clean. I can now approach my patients. Hello, my name is Violet, and I'm one of the nurses looking after you today. Is it all right if I confirm your full name? Haley Brooke, perfect, and your date of birth, honey? 15 February 1940, perfect. And your hospital number, can I double check that with your wristband? I have here Ellie Brooke, date of birth 15 February 1940, hospital number 10010. Assessor, with the paperwork on my hand, I can confirm I have the right patient. Haley, my love, can you please confirm to me if you have any allergies at all to food, latex, adhesive, or the NGTUBE, please? You have no allergy. Perfect. Haley, the reason I'm here this morning is because the doctors are not happy. You're not feeding fine. You know what I mean? You've not been able to swallow. So the doctors wants me to pass an NGTUBE for you because that is going to really help you, because we'll now be feeding you through the NGTUBE. So Haley, are you happy for me to pass the NGTUBE? This is a convenient time. Oh, perfect, bless you. So it's just gonna take less than 8 minutes, okay? If you are happy, I'm going to assemble all my equipment. Is that all right? Oh, bless you, my love. So if it's all set up for you in a tray or in a trolley, just go ahead, do your hand hygiene, put on your apron and put on your glove. Most times it's all set up for you in a tray or a trolley. But if it is not, I put on my I do my hand hygiene first. Put on my apron, put on my glove. This is my tray. I clean my tray with Clean Air wipe. After verbalizing, your Clean Air wipe is still in date. My tray is clean now. I put the Clean Air wipe in the clinical waste, and I assemble my equipment. This is my Clean Air. This is my NG feeding tube. The expiry date is 2023. It's still valid. I put it. This is my strip. This is my Intera pH strip. It will be in its container. This is my Intera pH strip. The expiry date is 2023. It's still valid. I put in my tray. And remember, the gastric content has been labeled for you. A gastric content is labeled for you. So this is my gastric content. Is still, I put my gastric content on the tray. This is my warm water. The warm water is set and is labeled for you. You put your warm water in the tray. This is my plaster. My plaster is still valid, is not expired. I put my plaster in the tray. This is my gauze. The gauze is still valid, is not expired. I put my gauze in the tray. And so you've gathered all the equipment you need, you put in the tray. Take away your apron, take away your glove, put in the clinical ways, do your hand hygiene, put another apron and glove, and proceed to the patient. Remember to pick your 50 ml syringe, purple syringe, 50 ml. Pick it, verbalize the stay in date, put it in the tray, then go over to your patient. Hello, Haley, my love, I'm back. Are you all right, honey? Are you happy for us to commence? All right, my dear. I can assure you your privacy is maintained already, okay? Haley, before I put this NG tube, can I just let you know, if when I'm putting the NG tube, you want me to stop, can you just raise your hand so that you let me know you want me to stop? Is that all right? Oh, bless you. And please, Haley, while I'm putting the NG tube, do you mind swallowing? As I'm putting the NG tube, do you mind swallowing for me? Because when you swallow while I'm putting the NG tube, it's very easy for it to get to the exact position. Is that all right, Haley? Perfect. Haley, can I just confirm that your nostrils are patent? Do you mind sniffing for me with one of your hand covering the other side of your nose, my love? All right, honey. So sniff for me with one hand covering the other side of your nose. Perfect. Can you do the same to the other side? Perfect. So, Haley, I can see that your nostrils are patent. And Haley, while I'm putting the NG tube, I can let you know if I feel any obstruction, I'm going to stop. So is that all right, Haley? Bless you. So, Haley, the final thing I'm going to be doing is that I'm going to be measuring your nostrils with the NG tube. So I'm going to be measuring the NG tube from the tip of your nose down to the ear lobe and down to the symphysis sternum. Is that all right? Bless you. So now I've told the patient, raise your hand if you feel you want me to stop. I've told the patient while I'm putting the NG tube, the patient should be swallowing, which makes it easy. And I've told the patient to sniff the nostril to make sure that the nostrils are patent. If you do this, guys, you're top notch. So now, remember, I've assembled all my equipment. So now, I pick my NG tube and I'm going to be measuring. What am I measuring? I will use my son's teddy bear. You are going to measure from the tip or from the bridge of the nose, from the tip of the nose or from the bridge of the nose down to the ear lobe. Remember, you are wearing an apron and a glove. Down to the ear lobe, and you are going to take it from the ear lobe. Sorry, you are going to measure from the tip of the nostril. This is the tip of the nostril, this point of the nose. Yeah, so measure from this point of the nose down to the ear lobe. Now you can leave this, and from the ear lobe down to the symphysis sternum. You know the symphysis sternum. Usually you will get about 50 something, 60 something. Now take note of the measurement. Somebody will say, how do you take note? It's numbered. Take note of the measurement. So assume I've gotten 65. I take note of the documents. I take note of the measurement. Some people usually mark it, but you can take note because it's measured. I've gotten what? 65. So I take note of the 65. Now, what will I now do? I will lubricate from the tip up to 15 to 20 centimeter. So I'll put this in what? In the warm water to lubricate it. So I will lubricate 15 to 20 centimeters to lubricate it. If you don't want to lubricate up to 15 to 20, you can lubricate from the tip. Endeavor to lubricate it. Endeavor to put the NG tube in the warm water. Please lubricate it in the warm water. All right, guys. After lubricating it in the warm water, all right, Haley, do you mind sitting upright for me, honey? Sit upright for me, all right? If you feel the patient is not sitting upright enough, you can verbalize. Can I get help with sitting the patient upright, please? And the assessor is going to support you to make the patient sit upright. But sure, the patient is already in the right position for this NG tube to be passed. So the patient is sitting in an upright position. So what do? You have checked that the nostrils are patent. You have assessed the nostrils. So while checking the nostrils are patent, you're also assessing the nostrils, because a nostril that is not patent, of course, you can pass an NG tube. So you're sure the nostrils are patent. So I have lubricated this with warm water. So what do? You insert the NG tube. Ask the patient their preference, either the right or the left nose. But whichever you insert it, even without asking the patient the preference, is fine. So I will insert my NG tube. So I'm inserting my NG tube, and I'm going to be stopping if I notice any obstruction. Ellie, my love, please don't forget to tell me, all right? Don't forget to tell me if you want me to stop, okay? And remember, keep swallowing, bless you. Oh, she's swallowing, so keep swallowing. So now it's gotten to 65. 65 has appeared. Once you see 65, where is it going to appear? At the top of the nose, you see the number. Once it's reached the number you marked, remember it was 65. All right, Haley, thank you so much for swallowing. Now we've reached the desired number. I will just put my plaster to secure this in position. I will put my plaster to secure this in what? In position. So your plaster is already here, securing it in what? In position. So after putting your plaster to secure this position, you said, well done, my love. Thank you so much. So now you have to take a kidney dish to make sure this is on the kidney dish. Everything is all set out for you, so don't worry. Now you are going to be aspirating. So you've had it in position. You are going to verbalize that you are going to be aspirating. If you like, you can aspirate. But mind you, the gastric content has already been provided for you. The gastric content is already provided for you. So you are going to verbalize, I'm going to be aspirating, just to endeavor or to make me check that the tube is in placement. So if you like, aspirate. If you don't like, take the gastric content they've given to you, put on your pH strip, and after putting on your pH strip, you check for the number. You have to turn the back and check, and if it's less than 5.5, you verbalize that is less than 5.5, so the tube is in placement. You have to do what? You have to commence feed. So guys, that's all about the NG tube. Really simple. Even if you've never done it, it's really very simple. Even sometimes, maybe because you are anxious, endeavor to verbalize. Even if you don't finish completely, you don't do the test, endeavor to verbalize it that I'm going to be checking the tube is in placement, so I'm going to be aspirating the gastric content, and I'm going to be putting on the tube, and if it's less than 5.5, I'm going to be sure that it's in the right placement and feeding can commence. Guys, really simple. Not very simple. In fact, you don't need to see all the things before you do them. Put this in warm water. Endeavor is in warm water. You can put the tip. You can put 15 to 20 centimeters. You can just hold 20 centimeters and dip it in the warm water and straight to the nose. You just tell the patient, if you want me to stop, raise your hand. As I'm passing it, please, my love, be swallowing. And once you reach that centimeter, you put plaster on the nose. You use your purple syringe. Try to aspirate any gastric content. Whether it comes, it definitely will not come now. You know it's a mannequin. They've given you a gastric content. Put it on your pH enteral strip. Verbalize if it's less than 5.5, feed will commence. That is all the way. If you can do this, more than the sky is your limit. Of course, you are going to be successful in your all-ski exam. Thanks, guys, for your massive support. Don't forget to share this video with your friends preparing for all-ski exam. I'll see you in my next video next week. And until then, keep passing your all-ski exam. Bye, guys.